Okay, you guys know where the adrenal glands are located, correct?
Yeah.
Okay, superior aspect of the kidneys, folks. These are the adrenal glands that we're going to be talking about. Okay, well, these are the only adrenal glands, but these are the glands that we're going to be talking about. The adrenal glands are separated into how many sections, folks?
Two.
What's the inner core called? Medulla. It's important you guys know that the medulla secretes epinephrine and norepinephrine. All right, so write that down. The inner or the medulla of the adrenal gland produces epinephrine, norepinephrine. When we talk about the cortex, it's the surrounding structure, okay, the outer portion of the adrenal gland. What does that produce? MCs, GCs, and sex hormones or androgens, right? So you have sex hormones, glucocorticoids, which include aldosterone, okay? Mineralocorticoids, excuse me, that include aldosterone, and glucocorticoids that include cortisol. Thank you. She's like, oh yeah, that's right. So again, mineralocorticoids, and think about it like this, folks. Think about it like this, so I won't forget. I have to think about it like this. Mineralocorticoids, minerals. What's sodium? That's a mineral, right? So that's a mineralocorticoid. What secretes? What's responsible for the retention of sodium? Aldosterone. Okay, aldosterone. How about glucocorticoids? Sugars, right? Cortisol deals with sugars, and then you have the androgens or the sex hormones. All right, so now that we've discussed that, let's jump into this. So with adrenal hyperfunction, or something called Cushing's syndrome, what do you guys think about when you hear Cush? With a K.
Okay.
You're getting high, right? All right, so this one's an elevated form of adrenal abnormal function, okay? So adrenal hyperfunction is Cushing's syndrome. So know it like that, guys. Cushing's syndrome is high, okay? The plasma levels of the adrenocortical hormones are increased. Hyperplasia of the adrenal tissue due to overstimulation by the pituitary gland. It could be a tumor of the adrenal cortex. Okay, so if the adrenal cortex is being affected, what hormones are going to be elevated? Yeah, that's right. The the mineralocorticoids, and the sex hormones. Adrenocorticotropic hormone, or ACTH, secreting tumor outside of the pituitary gland. That could be a hyperfunction as well. So meaning the actual anterior pituitary gland is secreting too much of its adrenocorticotropic hormone that stimulates the adrenal gland to secrete too much of its substance. Does that make sense? All right. It could also be due to an overuse of corticosteroid drugs. So if we're using solumedrol or prednisone, the plasma levels of these hormones are continuously high. So this can actually cause Cushing syndrome as well.
What about like hydrocortisone cream?
No, not hydrocortisone cream, because if you look at the hydrocortisone cream, what does it say? The dilution, 1% or 0.5% for the entire solution that's in this. So it's a very small amount, and it's just topical, so it's okay. But it does get absorbed though, but it's very localized. That's a good question. Man, so it's sled. You guys have the PowerPoint?
Yeah.
You guys aren't using it though, huh? Alright, and here's Cushing syndrome. This is one of the illustrations that I gave you folks yesterday. This will help you out to kind of help you memorize what exactly is going on with the patient. If you have hypersecretion of the hormones that are secreted by the cortex of the adrenal gland, are you going to have hyper or hypoglycemia? Hyperglycemia. So you have hyperglycemia, central nervous system irritability, personality changes as well. You'll have something called a moon face. Okay, it's nice and round, and something called a buffalo hump, which is a bump that patients usually get on the back, on the posterior portion of their neck. Okay, so moon face, buffalo hump is classic to the Cushing syndrome. Please write that down. Please highlight that if you guys see it. Okay, make sure, because I'm going to test you on that. Increased susceptibility to infection. Now, why do you think that happens? What have you guys learned about a patient taking steroids? If you're taking prednisone, there's a couple of side effects, folks. Hyperglycemia and immune suppression. So if your steroids are really high, your immune system is a bit depressed, so you're susceptible to infections. So increased susceptibility to infections, Males, they develop gynecomastia, meaning breast, okay? Breast tissue. Fat deposits on the face and the back of the shoulder. So if we look at this particular area right here, so it's the back of the neck and between the shoulders, that's where you get the buffalo hump that it's referring to. And I'll show you a little illustration in just a bit. So what does Na stand for the Na in fluid retention?
No,
Sodium, okay? The patient will end up developing edema. I have a cousin that looks like this. Every time I see her, I'm thinking, oh my God. She's really tall too, she's really tall. Thin extremities though. Okay, so the actual core, the torso is going to be pretty bulky, retaining the fluids, but the extremities are very thin. GI distress as well, increased acidity. Females will have amenorrhea, hirsutism. What's hirsutism?
Hair.
Yeah, facial hair, okay. Thin skin, purple striae. You guys know what purple striae is? Okay, they're stretch marks. Okay, not only on the legs, but they usually develop them in their abdomen area as well. So they'll have really deep stretch marks. Bruises and petechiae, also very important for you guys to know. You folks remember what petechiae is?
Yeah.
Little blood dots, okay, capillary ruptures. That's petechiae. And the patient will also develop osteoporosis. So again, I'm going to talk about the real important manifestations. They're all important, right? But the real important ones, okay? Moon face, buffalo hump, hyperglycemia, depressed immune system, okay? Amenorrhea for females, gynecomastia for males. Moon face, buffalo hump, increased susceptibility to infection or depressed immune system, hyperglycemia, gynecomastia for males, and amenorrhea for females. And again, moon face, buffalo hump, Cushing syndrome. Man, switch the slide. Alright, so again, clinical manifestations. This is like the fifth time I'm going to say it. Moon face, buffalo hump, thin arms and legs, hypocalcemia. Why does this patient have hypocalcemia? If this patient's retaining fluids, right? They're retaining sodium as well, right? What do you guys remember? I don't know if you remember this, but the relationship between sodium and potassium.
When it's up, the other one's down.
Yeah, essentially, when they swap, potassium is really, think of potassium being very important, very heavy, right? It's a very heavy, very powerful electrolyte. So in the cells, when the exchange occurs, they swap 2 sodiums for 1 potassium. So as the sodium increases in the body, you have less potassium. So you start excreting potassium. So you develop hypokalemia. Please know what that word is, hypokalemia. This is what happens because you have increased aldosterone. That means you're retaining sodium. So if you're retaining sodium, the actual potassium is going to be low. That's why you have hypokalemia. Proteinuria, you're going to be getting rid of protein in your urine as well. That's abnormal. I don't know if you guys remember, have we done GU yet? Genital urinary?
Yeah.
Oh, we'll get to that then. Proteins, folks, inside your urine is something you're not supposed to have. And that also has to do with the relationship, with the exchange of electrolytes and particles inside the kidneys when you have an elevated amount of minerals. So you'll have proteinuria, which is bad. You don't want proteins in your urine. You're not supposed to have anything like that. Increased urinary calcium excretion as well, hence the osteoporosis. Remember the osteoporosis in the previous picture? If you don't have calcium in the body's getting rid of the calcium, you're going to have limited supplies, hence your bones are going to be lacking calcium as well. Susceptibility to infections. Don't only know this, folks, for the adrenal hyperfunction, but anytime a patient's taking prednisone or Solumedrol, write those down. Prednisone is Prednisone. Prednisone is Prednisone. Okay, or Solumedrol, just how it sounds. Solumedrol. These are corticosteroids. These are powerful anti-inflammatory agents. Anytime a patient is receiving this type of therapy for quite some time, their immune system is suppressed and they become susceptible to infections. Okay, you folks know what opportunistic infections are? On a daily basis, my son, we just went to the park a couple days ago to a party on Saturday or Sunday, I forget. I think it was on Saturday. And what does he do? He goes to the backyard was all concrete. He goes to the only part that's dirt, and he sees it and he goes, and he jumps in. So for like 3 hours, he just played in there. And he got dirty like you wouldn't believe. Dirt all in his nails, but I liked it because he's never sick because of that. Well, he's healthy. Oh, I hope. He didn't catch anything because his immune system is tough. Any type of bacteria that he encounters, his body kind of just rejects it and beats it down because he's got a healthy immune system. However, if you're taking these medications or if you have this condition, your immune system is suppressed. So any type of infection that your body would otherwise break down and take care of, it's not happening with this condition. So you develop opportunistic infections. Does that make sense?
So if you can get it, you will.
Pardon me?
Like if you can get it, you will.
Yeah, exactly. If you can get it, you will. I just finished watching, you guys see that movie Philadelphia?
Yeah. No.
With Denzel Washington and with Tom Hanks? What's his name? Tom Hanks has AIDS and he's also susceptible to opportunistic infections because his immune system is depressed. Good movie, by the way. You guys should watch it.
You should watch it here in class.
I know, we'll just say because of the depressed immune system, huh?
Yes.
Sir,
Yes.
so you said that prednisone and salbutamol, the side effects are susceptible to infections when the immune system is suppressed. And what else?
You retain fluids. You retain fluids because look what's happening here, right? These people are retaining fluids. They're retaining sodium. They're retaining fluids because of that increased aldosterone. And again, aldosterone retains sodium, and sodium pulls in water. So same thing with prednisone.
I got a question.
Yes.
It's related to that too, but so patients that have like lupus, their immune system's already low, but they're given prednisone to help fight stuff. Wouldn't that make it worse?
That is, so if you look at the precautions for somebody that has lupus, folks is a widespread autoimmune disorder that the cells attack the tissue. And you'll see the classic butterfly rash. These patients have a lot of hip issues, a lot of joint issues, excuse me. So you give them prednisone, but why do you give them prednisone? Because your body is attacking itself. So if you look at the joints, they become really inflamed. So you want them to decrease the inflammation, and that's the whole purpose. And yeah, their immune system is compromised. So they have to take meticulous care of any type of sore that they have. They have to wash their hands constantly, and they have to always be looking out for any signs or symptoms of infection. Yeah. Have we talked about lupus yet?
Yeah.
You did.
Yeah, tracking.
You wasn't here.
I was
You
there.
missed the topic.
Okay. Anyway, so please remember that, guys. Okay, all the side effects of either taking prednisone or corticosteroids is what it is. That's the umbrella term, the classification. And what happens with adrenal hyperfunction or Cushing's syndrome? Okay, Cushing's syndrome. Oh yeah, and then depression and loss of libido. Patient will also develop ecchymosis, petechiae, weight gain, abdominal enlargement, hirsutism in women, menstrual irregularities, amenorrhea, deepening of the voice, and again, hypokalemia. Any questions on these so far? For Cushing's, is Cushing's high or low? High. Okay, so what three element? Oh, excuse me. First of all, what part of the adrenal gland is being affected? The cortex. Okay, the cortex. What three elements are secreted by the cortex? Mineralocorticoids, glucocorticoids, and sex hormones. When it comes to mineralocorticoids, which is the most abundant one that we've been talking about? Aldosterone. Aldosterone. What does aldosterone do? Okay. When it comes to mineralocorticoids, when it comes to glucocorticoids, which one's secreted abundantly? Cortisol, which is a component of that. Cortisol. Cortisol. All right. Did you guys write down cortisol? If you didn't write it down right now, again. Cortisol. I'll talk about that in a little bit. All right. So this is what it looks like. She looked like this. Now she looks like this. What was that? What was that? Too many what?
Buffets.
Buffets?
Buffet.
Oh, buffet. Yeah. If she would hear you, she'd be pissed. You see that moon face up? I don't have that. I just have big cheeks. Okay. I heard you, whoever said that. So look, this is a striae that I was talking about, the red striations. This severe stretch marks that the patient develops, folks. The breast, the stomach, the thighs. This is the moon hump that I'm talking about. My cousin, look at me, really guys. I know you guys are recording. You don't know who this is, but my cousin looks just like this. I mean, I don't know what she looks like without clothes, but like this. Like her face, she's got short hair like that. She looks like that. She's a jerk, that's what I'm talking about. She's really rude. But anyway. Blood pressure high or low on these patients?
High.
Why?
They're retaining sodium.
Yeah, they're retaining sodium. All right, good. All right, so medical treatment. You want to treat the causative factor. So if there's a tumor somewhere, you get rid of the tumor, or you treat it with radiation to reduce the size of the tumor so it won't affect the secretion of the adrenal cortex. So you can have an adrenalectomy for an adrenal tumor, radiation or surgical removal of the pituitary tumors as well. If the pituitary gland has a tumor, which is a hormone that's being secreted that's stimulating the adrenal cortex, the adrenal gland. The adrenal corticotropic hormone. It's ACTH. Good. Make sure you guys know that, okay? You can give Lysodren, which is a medication. Not too often used, but it's there. Dietary recommendations are really important, okay? So, what's up with the sodium? What are you gonna give them? Low sodium. Okay. What was that? DASH diet. High potassium because they're lacking potassium in the bloodstream. Okay, guys. So low sodium, high potassium. What food groups or what food elements contain high sodium?
Potatoes.
Yeah, potatoes does have a lot of sodium.
Canned food.
Fast food, canned foods, processed foods. That's what's gonna ask you. That's what's gonna be asked of you folks. Okay, canned foods, processed foods, fast foods. No, that's what has high sodium in it. It's bad.
That's why it's bad.
That's why it's bad. No, I'm not saying to eat it. I'm saying if you guys go to like the 99-cent store. Anyway, and you see all these cans of I mean, seriously, if you spend like $10, you could get so much food. But if you look at the sodium content, folks, it has so much sodium. So much. You guys know that sodium works as a preservative as well, right? You guys know that my mom and my dad's dad, my grandfather, that he passed away already, but he used to make leather in Mexico back in the day. So my dad was lucky; he had meat every Friday, because he would get the leather, and the leather would still have some meat on it. He'd cut it off. You know, the skin would still have some meat. He'd cut it off, and then we have meat every Friday. So sometimes though there was no refrigeration back in the day. So how would they preserve the food?
Salt.
They get a bunch of salt and they just rub it all over the meat, and then they hang it. Yeah, and it becomes like jerky, and that preserved it. So as a kid, my mom and my dad would still do that because that's what they were accustomed to. I'm like, the fridge is right there, the microwave is right there, but they would put salt on everything. And my sister, you guys should see my sister eat. She'll put salt on salt to eat. It's bad. But anyway, low sodium, anything that's processed, anything that's canned, anything that's fast food has a lot of sodium in it. That's why it's delicious. You guys ever hear the term food's not supposed to taste like that? Or food's not supposed to be that good? Okay, food's really not that good, but man, when we put stuff in it, it's really good. High potassium, folks. What's high in potassium? Potatoes. Bananas. Potatoes is more, but yeah, bananas. What's that? Anything that's fortified. You folks know what fortified means? Enriched, meaning something they add to it.
Molasses.
Okay, molasses. Who said that? You read the book, huh?
Well, it's from our.
Yeah, I remember saying that too. That's good. Yeah, molasses. You guys know what molasses is? Molasses. Yeah.
What is it?
It's like it's a syrup of different types of vegetables, fruits. I mean.
You use it to make ginger ale.
Okay, that's pretty much all I know about molasses. All right, let's talk about the opposite of Cushing syndrome, folks. Addison's. Okay, Addison's. This is adrenal hypofunction, meaning the decreased amounts of the cortex hormones. Adrenal glands do not secrete adequate amounts of glucocorticoids and mineralocorticoids. It may result from an adrenalectomy, pituitary hypofunction, or long-standing steroid therapy. This is the one I want you guys to really know. Long-standing steroid therapy. Meaning if I have, what's that one that you were just talking about? If I have lupus, okay, and I talked about lupus being an anti-inflammatory disease where your body attacks itself. So my joints are always inflamed, so I need some powerful steroids. And they give me, which one of the two? Which
Prednisone.
one? Prednisone, thank you. So they give me prednisone, and I've been taking this for 3 months now. Okay. If I've been taking this for 3 months and I stop the usage of prednisone, what happens? You develop this. Okay. You develop this. What ends up happening is my bloodstream, my body thinks that I have a certain amount of hormones in my body.
Isn't it adrenal crisis?
Adrenal crisis. Okay? This is called adrenal crisis. So my body thinks that I have a certain amount of hormones. And then you stop the medication, and my adrenal glands aren't producing the hormones. So I have something called an adrenal crisis, an Addisonian crisis. So please know that, folks, a long-standing steroid use can actually lead to this. Man, what's the slide? Clinical manifestations include related imbalances of hormones, nutrients, and electrolytes, nausea, anorexia, postural hypotension. You see how the one was hypertension, this one's hypotension? Headache, disorientation, abdominal pain, lower back pain, and anxiety. When it comes to Addison's disease, which one's, Addison's or Cushing's, which one has like the most impressive clinical manifestations, or most notable ones? The other one, right? Cushing. Yeah, Cushing does. All right, good. May I switch the slide? Oh,
Like the book said that they crave for salt.
that's right. Why do they crave for salt? Because they need it. If you have, yeah, you have. There you go. So you guys are catching the trend now, right? If you have decreased secretion of these elements, the body's gonna be. The body has a way of action. You guys ever hear of a woman who's pregnant that has a sensation to eat different things? So it's called pica. The body is programmed in such a way that during moments of stress or whenever there's deficiencies in your body, like something triggers it. Some people call it instinct. Some people call it different things, but to get different types of minerals in order for your body to be adequately nourished. So your body can pretty much take care of itself. Alright, so darkly pigmented skin and mucous membranes. This is very important for you guys to know about Addison's disease. Weight loss, vomiting, diarrhea. If you have diarrhea, folks, what type of complications are we going to develop? Dehydration, also electrolyte imbalance. Okay, also electrolyte imbalance. If you have diarrhea, what pH imbalance are we going to have? Acidosis. Metabolic acidosis. Okay, you guys remember why? Yeah, all the fluids have a lot of alkaline in it, a lot of base, and if you have diarrhea, you're getting rid of the base, the alkaline, the acid goes up because there's less alkaline. Hypoglycemia, hyponatremia. This is why they have an urge to desire to eat sugars, Miss J. Salts. Salts. And sugars. Hypoglycemia, hyperkalemia. You guys see how it's all reversed now? But I want you guys to understand why. Why and how are the most powerful questions you guys could ask. Don't ask me those questions sometimes because I don't know the answer. However, though, I'm just kidding. But hypoglycemia, because you have a depressed secretion or decreased secretion of your gluco and mineralocorticoids, right, for those two. Okay, so if you have less sodium, which has an inverted relationship with potassium, what's your potassium going to be?
Higher.
Okay, high, and that's what happens. Okay, good. So that's what's happening here, hyperkalemia. How can you get rid of high potassium? Increase it? You can, but that's not the way you want to do it, though. Kyaxalate, excuse my spelling, it's probably not spelled correct. But if you guys type it in Google or look it in your book, the first 2 letters are correct. All right, so Kyaxalate is a medication that you give, or the first letter, I don't know. But this medication, folks, you give for a patient who has hyperkalemia. When they have increased levels of potassium in their body, you give them this medication. It's a little solution. Usually they take 15 to 30 mLs. And it comes a little, it doesn't really look like a medication. It looks like mud in a cup. And it smells really good. Well, I think it smells good. And it tastes horribly. You drink it. Okay? Huh? No, the patient tells me it tastes horrible. I smelled it though. I go. And when you give this patient this medication, it causes diarrhea. Okay, it causes them to defecate. They actually absorb the potassium from in the colonic area, and they excrete the potassium. So understand that Kyaxalate is a medication that we give to decrease potassium levels. Does that make sense? Decrease. Yeah, decrease because it's high. Yeah.
What about vitamin E?
Pardon me?
Vitamin E?
Vitamin E? What about it? Not significantly though. See, the thing about consuming any element that is gonna, okay, so vitamin E and sodium, let's say, I'll take these as an example. When it comes to the cells, folks, and the exchange of these elements, it does bring it down. However, it brings it down in a metabolic process, meaning it takes a given time. This medication, you take it, it goes through your GI tract because it's fluid. As soon as it's absorbed, you start defecating. And it pulls out the potassium. That's why these elements right here are a lot more efficient at bringing down the potassium. Does that make sense? Yes.
So how long is that going to last?
How long is what going to last?
The medication?
Just that one. You'll have a couple of bowel movements, okay, and that's pretty much it. And then we do another serum test to see where the potassium's at, and that's how we monitor it. What's the average potassium level?
3 to 5.
No.
9.
No, not 3 to 5. No.
9 to 10.5.
No, guys, please don't scare me. What's the average potassium?
3.5.
3.5. You were close. But you were so far though, because potassium, folks, is so delicate. Potassium is so delicate because if it's 3.4 or 3.3, this is going to start manifesting some type of muscle spasms already. So 3.5 to 5.0. Please write this down, guys. The serum potassium level, that's therapeutic, that's good. 3.5 to 5.0. 3.5 to 5.0. 3.5 to 5.0. That's good potassium level. Every hospital has its own policy, meaning the hospital at Kindred.
We need the 4 other people from Care Meridian. The 4 others from
Okay.
the opera.
Who's do you guys understand what I'm referring to when I'm talking about that you can develop Addisonian, it's called Addisonian crisis or adrenal insufficiency when you're taking medications like prednisone and then you stop taking them without tapering them off. Do you understand what I mean by, come on guys. You guys know what I mean by that Addisonian crisis or the adrenal insufficiency. You guys have to know what that is. So I'll talk about it first, and I'll put it up on the board in a little bit. So cortisol is a very important hormone that's produced by what? The cortex of the medulla. The cortex. Okay, that's the glucocorticoids. So cortisol is important for the regulation of blood pressure. So when we talked about mineralocorticoids having aldosterone regulates sodium. Its effect is it also regulates blood pressure, right? Because of the fluid content. Cortisol directly influences blood pressure. Okay, so if you have adrenal insufficiency or everything starts to decrease, your body starts kind of going into shock in a way. Not like hypovolemic shock, but it doesn't have this whole cortisol medication. Okay, and that's what actually causes the adrenal insufficiencies. Yes?
In what way does cortisol affect blood pressure directly? Is it an anti-inflammatory effect, or?
No, it actually just deals with the binding of different electrolytes so it can actually switch off fluids. And essentially that's what it does. That's what we need cortisol for. If cortisol isn't there, the BP gets all out of whack. Usually it goes up. Okay, so patients with this, with the adrenal hypofunction or the Addisonian crisis may potentially die if they don't actually have this. Okay, so that's just very briefly, I just wanted you guys to know what it is, okay? All right.
So you said everything's gonna be low.
The hormones, yes. Because there's nothing there. Think of it like if you're
And
taking...
hyperkalemia is still gonna be hyperkalemia, right?
Well, for what? Yeah, for this particular thing, yeah, it's still gonna have hyperkalemia. Yeah. Because hyperkalemia is not necessarily affected by the cortex, right? The cortex has the mineralocorticoids, which is the aldosterone, and aldosterone is gonna be low. So in return, the potassium is gonna be high. Because sodium and potassium have an inverted relationship. If the sodium is low, the potassium is high. If the sodium is high, the potassium is low. Alright. Addison's disease. I showed you guys this yesterday as well.
Can you turn the arrow further?
What was that?
Can you turn the arrow?
Yeah, it's too cold.
Like,
I like it like this. Sometimes it's I have to be a square. All right, so let's talk about Addison's disease now. Again, we've spoken about this already. So the bronze pigmentation of the skin, hypoglycemia. Okay, for Cushing syndrome we have hyperglycemia. For this one we have hypoglycemia. Postural hypotension, weight loss, GI disturbances, weakness, changes in distribution of body hair as well. You see her little mustache? Okay. It was a better mustache than I do. Okay, now look at this adrenal crisis right here. Okay, profound fatigue. So much so that you can't even get out of bed. Okay, profound fatigue. Dehydration. Why dehydration? Decreased sodium. Yeah, decreased sodium, so you're not retaining any fluids. Okay. Vascular collapse. Your blood pressure goes down. Did I say blood pressure goes up?
Yes.
Okay, I meant down. I'm sorry, guys. I meant down. Renal shutdown. Why do the kidneys start breaking down? Because of the fluids. Yeah, that's good. Yeah, because of the fluids. Okay, because of the fluids. Your sodium, of course, goes down, and your potassium goes extremely high. What medication can we give them to get rid of that potassium? Kyaxalate. Okay, I think I really butchered the spelling, but Kyaxalate. Does that make sense, guys?
Yeah.
What the hell do I do? Oh yeah. To the old PowerPoint. The first thing I thought when I look at him, I think about Bush, because Bush killed him, by the way. But you guys don't believe me, but it's
We
true.
saw the video.
Oh yeah, you saw it? Oh my God, that was you guys, huh?
Oh my God. Did he have Addison's disease?
He had Addison's disease, actually. He had. No, that's not gonna be in the test. But I'd like to keep you guys entertained. Thank you.
Should find that video.
Anyway, I forgot I showed you guys that documentary. I forgot it was you guys.
Don't remind us.
There's one more. Anyway, treatment includes restoring fluid and electrolyte balances, folks. So you look at whatever's happening to the patient, and you don't want them to stay dehydrated. You don't want to give them a medication to help them restore the adrenal function so that they can be hydrated. You attack it right now. So you give them fluids, you give them electrolytes. What type of fluid do you think we're going to give them? What was that? An isotonic solution. Good. What type of isotonic solution? Did someone say Pedialyte? I heard Pedialyte. No. You give them a normal, isotonic is normal saline. That's 0.9. Normal saline is fine, yeah. And you give them electrolytes, replacement of adrenal hormones as well, because you also want them to start regulating themselves. I know, but this patient, you want to give them IV, that's why. You want to give them IV. That's why I thought Pedialyte was funny. Look at this one, a diet high in sodium, low in potassium. Okay? Okay, high in sodium, this is probably the only time you're going to see an intervention that includes giving the patient high sodium amounts. And even when you give them high in sodium, it's still conservative. Like if you're talking about low sodium diet, it's like 2 grams. If you talk about high sodium diet, it's like 2.5 or 3 grams. It's not like 4 grams, right? It's not that high, but high sodium diet. When adrenal crisis occurs, you give them IV corticosteroids in a solution of saline and glucose. Why glucose?
Because they have.
Because it helps the whole sugar. It helps with the sugars, right? Okay, good. And same thing with saline. It increases the salt content or the sodium. May I switch the slide? All right. Before we jump into this, you guys have any questions about Cushing syndrome, Addison's disease? Okay, you guys have any questions about Graves' disease? What's Graves' disease? Hyperthyroidism. And then you have hypothyroidism. What happens if you have, what are the parathyroid glands, where are they located? Behind the thyroid gland, right? Okay, so we've done, how many are there? How many nodes? 4 nodes. What do they secrete? Parathyroid hormone.
Breaks down the bone and.
I'm getting to it. What stimulates the parathyroid gland?
Calcium levels?
Okay, to perform its to release its hormones.
The ACT.
To secrete its hormones.
Calcium levels?
You're right. The calcium levels, folks. Once they actually go up and they go down, it stimulates the parathyroid gland to release its hormone to bring it back up. What does calcitonin do? It decreases. So if I have hyperparathyroidism, you guys got that? Hyperparathyroidism. I'm trying to think of it too. It's not because okay, if you have hyperparathyroidism, what's going to be elevated? Okay, the calcium level is going to be elevated, right? What organ is going to not have that calcium? The bones. What's the patient at risk for? Osteoporosis, pathological fractures. You guys see how you guys connecting the dots with this? If you have hypoparathyroidism, okay, what's the calcium level going to look like? Low.
So you're gonna be weak and.
Low. And what? There you go. So if your calcium levels are low, first of all, what does calcium do to the body? How does calcium function in the body? What does it help us do? Okay, bones, muscles. So if you have low calcium levels, what happens to your muscle activity? It weakens, and what do you develop? Spasms, also known as tetany. What test can you? Shvastex and trousers. Okay. One more thing, guys. How are your kidneys affected by hyperparathyroidism?
Hyper. They're taxed with all the calcium in the blood.
Oh, renal calculus.
Renal calculi, or stones in the kidneys because of the excess levels of calcium. Okay. Okay, you guys are okay. You guys take the test after this. It's fine. Let's talk about pheochromocytoma. We've talked about the adrenal cortex. This is the adrenal medulla. Okay, that's what this is referring to. Hey, is this a cell phone? What is this? Is a cell phone? Watch. You guys see my marker?
I'm buying that watch too.
Okay, so we're talking about the medulla now, right? That's what this is, folks. This is affecting the medulla. Don't look at it, guys. What hormones are being secreted? Nori and epinephrine, also known as adrenaline. Yeah, it's your fight or flight, but it's also known as adrenaline. So if you guys ever hear adrenaline is high, adrenaline is low, it's talking about the epinephrine, norepinephrine, the fight or flight effect. Okay? So, the pheochromocytoma, chromaffin cell tumor. Chromaffin cells, folks, are the cells, that are responsible for secreting your epinephrine or epinephrine. And inside the medulla, you have cell structures that look like this. Okay, and these are specialized cells that line the inner aspect of the medulla, and then you have other specialized cells in here, and then you have other specialized cells. All these different cells, folks, produce different types of hormones. The most basic ones are epinephrine, norepinephrine. When we talk about the cortex, we're talking about 3 classes, and we spoke about cortisol, sex hormones, and aldosterone. Did you guys know those aren't the only hormones that are being secreted? You know there's hundreds of hormones that are being secreted? Okay, but the highest abundant ones are the ones that we talk about. Same thing with this one. So, there's a tumor in there, okay, an excessive growth of tissue that's actually causing the cells to secrete too much of the hormone or an abnormal amount. So usually found in the adrenal medulla, causes excessive secretion of epinephrine and norepinephrine. What's the difference between epinephrine and norepinephrine?
Epinephrine more potent.
Okay, it's a little bit more potent. It's kind of like Coke and Diet Coke. Floyd Mayweather and the other guy that got beat up by Maidana. You guys know what I'm talking about? You guys don't watch boxing?
No.
Bad joke. Alright, I'm sorry. But Coke and Diet Coke, you guys get that part, right? Okay, so that's all it is, folks. You guys don't watch boxing?
We didn't have time for anything.
Remember the name.
You guys know who Floyd Mayweather is?
Yes.
Yes.
Okay, who's his little brother?
His
I forget his
little brother?
name.
You're talking more.
Not little brother, but what's his name? Oh my god. Anyway, he's a diet version of him. Anyway, but that's what epinephrine or epinephrine is. Essentially, it's the same thing. It's just not as strong. Okay. Clinical manifestations: hypertension. That makes sense, all right? Because everything everything that's going to make you fight or flight, which is going to increase. It's going to increase your metabolic processes. I don't want you guys to think metabolic as like the thyroid gland. It's just everything's going to increase. Hypertension, high heart rate, tachypnea. You guys with me on this one? Okay. Medical management, surgical removal of the tumor. And that's pretty much it. How common is this? Not too common. Okay? Before they get rid of the tumor by removing it, what other means of reduction of the tumor are we going to? Radiation. Radiation. Usually radiation. Okay, and essentially this is what happens. You can't really tell. This is a kidney that's split in half, and you have the adrenal gland. Okay, that's up here, and this is the cell that's the tumor that's actually growing. The chromatin cell. And that's it, folks. That's it for the lecture.